Hello, welcome to Patient Confirmations, 5 Things You Need to Know. This is a TeleVox webinar focused on patient outreach for appointment confirmations. Our agenda today is to share some valuable information from our experience with thousands of healthcare providers. What we're going to do is walk through a list of 5 key lessons that we've learned after years of our experience. We send phone reminders, email reminders, and SMS reminders. All of them have the same goal. Here at TeleVox, we just want to provide tools to our clients that help them engage their patients and customers. You know, from the perspective of a healthcare provider who schedules daily appointments for service, the appointment reminder is the most simple but powerful form of patient engagement. You know, I'm sure that if you look at some of the topics here on your screen, you would agree that at least one or more of these are a problem for you in your practice. Often you have patients who are breaking their appointments, and that leads to results such as lost revenue, or maybe you've scheduled some providers or clinicians to be in the office and now they're underutilized because patients aren't showing up. Maybe you've tried to do some reminder calls before, but you find there's just too little staff time to make that happen. Or you found that mailing reminders incurs postage costs that are just too high. If you have some of these problems, you're not alone. The problem of lost healthcare receivables due to missed appointments is internationally recognized. A study in Britain revealed an estimated loss of $900 million due to missed appointments in 2007. Though we couldn't find a direct study source for lost revenue in the U.S., the yearly report produced by the Department of Health and Human Services concerning health in the United States estimated that there were about 1.1 billion visits to physicians and outpatient facilities in 2007. Assuming an average U.S. no-show rate cited by sources like the American Hospital Association, right around 8%, TeleVox estimates around 96 million appointments are missed in the United States each year. An assumption of $150 in revenue per appointment reveals the potential of up to $14.5 billion in lost revenue in 2007. At TeleVox, we find this to be a staggering result. Here at TeleVox, we have seen automation of appointment reminders and related alerts have tremendous impact for healthcare organizations of all sizes. Today, we'll share with you the top 5 lessons we've learned serving thousands of healthcare clients and sending approximately 5 million notifications via voice, SMS, and email each week. Oftentimes, we've heard speculation as to whether appointment reminders will actually impact no-show rates. At TeleVox, we conducted a survey with about 3,000 healthcare practices participating. Of those surveyed, we learned that practices who reported using no appointment reminder strategy at all were much more likely to report no-show rates over 10%. From this study and from years of experience automating reminders, we take our first lesson. Appointment reminders can reduce no-shows by as much as 25%. Take a case study with the Hand and Shoulder Center of Buffalo, New York as an example. The practice books about 1,000 appointments per month and reported a no-show rate of around 11% before going live with the house calls system. In the 3 years after going live with house calls, the practice experienced a 43% decrease in their average monthly no-show volume. This is particularly impressive considering their appointment volume actually increased by 13% during that period. Many potential clients who initially approach us are concerned that automating appointment reminders will create a less personal impression with their patients. We understand where this impression could come from when we consider some of the robotic-sounding voice technologies that have been utilized by phone systems in the past. But here at TeleVox, we offer a superior quality voice presentation that enhances the patient experience. Consider the perspective of your staff who are tasked with contacting patients each day. A medium-sized multi-doc practice could see around 100 patients a day. If you do the math, that's nearly 5 hours of manual calling activities daily for someone on your staff. Even the most enthusiastic and positive employee would begin to waver in their enthusiasm about halfway through such a calling session. At TeleVox, we've learned that automating calls has the counterintuitive effect of actually increasing patients' sense of personal touch. Here's why. Our systems can support the patient's choice for how they prefer to be contacted, and in their own language. Our calls utilize professionally recorded messages that are upbeat and customized to your practice. This allows for each patient to receive a consistently enthusiastic and positive message. Finally, our systems work while you're at home getting ready for the next day. Since our solutions are automated, they can call patients in the early hours of the evening when they're more likely to be available for a call. In our research, we found that manual calling strategies, presumably because they're performed during working hours, reach answering machines about 85% of the time. Another valuable lesson we've learned is that our estimates on the amount of time burned by staff who make manual reminder calls is not exaggerated. You can see here a testimonial from one of our clients. Kathy told us that a staff member was dedicating their entire day to making calls before they automated with house calls. The third lesson we've learned is that the savings in staff costs with house calls can be significant. In our survey of 3,000 healthcare practices, 72% said their staff could be better utilized on tasks that actually impact daily patient care, rather than sitting on the phone confirming appointments. The Jackson Eye Associates, one of our clients, shared with us that they experienced a 300% savings on monthly staff costs devoted to appointment reminders. They were able to redeploy resources away from the mechanical task of dialing phone numbers and focus those staff on providing a better experience to patients in the office. There's still a large number of practices who choose to use reminder cards sent via postal mail. Postal reminders can be effective, but with postal costs on the rise, nearly doubling since the 80s, this channel of delivery is not the most cost-effective. The fourth lesson we've learned is that automated appointment reminders delivered via voice phone calls, email, and mobile text messaging are much less expensive and more effective than postal reminders. In our survey of 3,000 practices, we saw a trend that many more practices reporting a no-show rate over 10% were using mailed reminders rather than phone reminders. And house calls can be used at a fraction of the cost of postal reminders. In addition to the cost savings and increased effectiveness, an automated phone, email, or SMS reminder has the additional benefit of enabling you to locate bad numbers and email addresses. Plus, unlike with postal mail, you get instant feedback as to whether your patients were reached and whether they can keep their appointment. So many of the lessons that we've learned about automated appointment reminders relate to efficiency, staff time, and cost savings. But often we have clients with smaller practices. Their appointment volume is lower, and they tend to focus their energy on creating a very personal touch when they interact with patients. Is automation worth it in these situations? We've learned that automation makes sense for practices of all sizes. In our survey of 3,000 healthcare practices, both large and small, 72% said their staff could be better utilized in other areas besides making appointment reminder calls. So even in small practices, the need to utilize staff for more impactful patient interactions is recognized. Using automation enables small practices to spend more time with patients, focusing on excellent customer service rather than drudging through manual calling lists. In addition, automation can help you detect bad numbers and get notice of cancellations in advance of appointments. After all, in smaller practices, each missed appointment has a larger impact on revenue proportionally. Thank you for listening to the 5 Things You Need to Know webinar. I hope the information we shared was helpful for you. At TeleVox, we believe strongly in the values of the healthcare industry. At the end of the day, it's about providing the best care to your patients. Patients appreciate the reminders, and practices enjoy the benefits. We hope you'll take this information back to your practice and evaluate whether TeleVox can help you.